When I was young, everything seemed so much simpler. There wasn't such a thing as the body, the spirit, the soul. It just all seemed to be me. And I think as I got older and as I became more knowledgeable, so to speak, I started seeing that your body does this and your mind does this and your spirit does this. And when this happens, this is a medical problem, this is a mental problem, this is a spiritual problem. It's that sense that those things are incredibly integrated and interwoven in a way that a person is not just a set of parts, nor is he a sum of parts, but it's this confluence of all these things that interact and work together in a way, and I think faith is an important part of that. My name is Ron Chacko. I'm from Lawndale Christian Health Center in Chicago, Illinois. So after I did my family medicine residency, I completed a one-year primary care fellowship with the Pacific AIDS Education Training Center. And I remember one of our Skid Row patients being hospitalized at LA County, and I was called to go see him. And there's a type of infection called pneumocystis pneumonia or PCP pneumonia. This pneumonia can be pretty severe and can basically take the wind out of you to the point where you really can't breathe. And this was the story with this gentleman. His oxygen levels were bottoming out. I was trying to explain why it was going to be important for us to proceed with intubation, or putting a tube down his throat to help him breathe. And I was really kind of taking my time and trying to get his feedback, and he would nod and I'd go on. And so at the end, I asked him if he had any questions. I was expecting a question about ventilation or, how long am I going to be on this? But he basically just looks at me and says, "Does Jesus love me?" And I was floored. I think it just gives me this opportunity at times to say, you know what, I may not be able to do much for you here, but can I pray for you? And you would have thought that was the thing that they wanted all along. I mean, it's just like the gasp of like, please, that's what I need. I think if we have a complete, a true understanding of the communities that we serve, we recognize, especially, where I serve in kind of a predominantly African-American community on the west side of Chicago, the church has always played an important role in those lives. I personally believe that you've got to expand healthcare into some capacity for everyone. And I fundamentally am kind of a proponent for the single payer system. And I think the ACA is a good step in kind of reducing some of that burden. But I think ultimately, if we really want to think about how to use healthcare systems effectively, we got to think about how do we get folks out of the emergency room and into primary care. And that includes those individuals who may not qualify for insurance in the ways that our current reform holds. We might all have other responsibilities that we have to deal with, but we were also given much because of the costs and sacrifice that other people have made for us. And I think with that comes our own responsibility to give and provide for others. We often think that we pulled ourselves up by our bootstraps, and I think if we're all completely honest, we recognize that there was a large group of individuals that got us where we are. Whether it's our teachers, whether it's our neighbors, whether it's folks at our church, no person has ever really made it on their own. I see that strongly in my Christian faith, but I see that also just outside of my Christian faith from just moral and an ethical principle about the fact that we're all brothers and sisters in God's image.